I work with quite vulnerable patients that are at home, so most of them are actually too unwell to come into the hospital. So I think it's really important, it's my responsibility to make sure that I'm potentially not carrying around something like the flu virus that I could be giving to very sick patients in the community. So I see it as part of my responsibility to try and protect them as much as protecting myself.
Last year, what we actually found was that there were patients who acquired flu whilst they were in hospital, and some of those patients were very unwell indeed. The second point is that because of the situation we actually had to close beds, and that has an impact on those patients waiting to get into hospital.
Research has shown that 77% of all people infected with flu have no symptoms whatsoever, so they could be sitting and standing right beside you and be infecting you right now, and they would have no idea and you would have no idea.
Flu is not just a common cold. Take it from someone who's suffered flu, it is a serious and significant illness and can take away both from your general well-being, your ability to deliver care, can put you at risk of transmitting it not just to patients but to your family and friends. And if unfortunately you have a coexisting medical condition, can actually be life-threatening.
People think there's lots of side effects and reactions to the vaccine. There's a 1 in 10 chance realistically of getting a sore arm and achy joints and a bit of a sniffly nose after vaccination, but that goes after 48 hours. If you do get that during 48 hours, paracetamol, Nurofen gets rid of it. This vaccine is given to millions and millions of people around the world.
I'd like to thank those staff, and I think we have 18% of our staff so far who've already had their vaccine. So, like myself, make sure that you go and get your vaccine ahead of time. Thank you.